This edition of Tech Talk is brought to you in part by Telex, the interconnection company, owners and operators of 56 Marietta, the most network-rich co-location facility in the Southeast. Tag TV and Tag Radio. Technology now has a voice of innovation and information. Get it on www.tagtvonline.com. The quality, the access, and the affordability of healthcare. It has Washington, the nation, albeit the world, buzzing over healthcare reform here in the United States. From the U.S. Senate to Georgia's own legislature, healthcare reform impacts bottom-line budgets from the individual patient to the hospital to the care provider to the taxes needed to fill government budget gaps. How does increasing technology drive healthcare costs? What are the newest technological advances, and how will they change healthcare delivery in the future? Greetings, everyone, and Merry Christmas. It's Tuesday, December 22nd, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. I'm your guest host, Frank Baia. The process continues as healthcare reform has Washington passing on holiday vacations to pass healthcare reform. The Tech Talk turns to one of the state's leading experts on this crucially important subject, Kirk Wilson, President and Chief Executive Officer for the St. Joseph Health System. In the mid-2006, Mr. Wilson served for 7 years as President of Our Lady of the Lake Regional Medical Center in Baton Rouge, Louisiana. A fellow in the American College of Healthcare Executives, Kirk is an accomplished healthcare executive who has served as a hospital president and CEO for the past 16 years in Louisiana, Texas, California, and Montana. From healthcare labor shortages to the key technology decision-making process from inside a major healthcare system, healthcare reform in the technology revolution of tomorrow, Tech Talk takes a look at healthcare with one of Georgia's top healthcare executives, President and Chief Executive Officer for the St. Joseph Health System, Kirk Wilson. Kirk, welcome to Tech Talk.
It's good to be with you.
Well, lots of excitement going on in Washington, and it's not just about the incredible weather, healthcare reform. Let's talk a little bit about that. Give us your view on the healthcare reform bill.
Well, as you know, the House of Representatives has completed its work and has passed a bill, since it contains some potential taxation, if you remember your 8th grade civics, it needs to start in the House and then go to the Senate.
Right.
The Senate held hearings all through the summer and fall through 2 different committees. Those committees' bills were amalgamated by the manager, who is known as the Majority Leader, Senator Reid, and he has now made additional amendments to the bill, and it's on the floor for debate, as you know, approaching cloture this week for a vote on the cloture, which will enable them to vote on the actual bill. The bill, I believe, is basically a good bill. The current healthcare system, as we know it today, certainly the healthcare financing system, is not sustainable. Fewer and fewer employers are able to afford healthcare insurance for their employees as they have typically afforded, especially if they're small businesses. Once people become unemployed, healthcare insurance is virtually unaffordable. So the numbers of people who want insurance and cannot afford it is growing every year and is morally unacceptable, I believe, in this country, especially the wealth and stature that the United States has. And as a result, we need to improve that. It's being paid for by a variety of taxes, cuts to almost every specter of the healthcare system. One of the reasons I know it's a good bill is because nobody likes it, which means that everybody's feeling a little bit of the pain, if you will, to make sure it happens. However, there's generally a compensating side for everybody that's a bit of an at-risk piece, and that's what everybody has to put their faith in the bill and working for hospitals particularly. We know that there will be potentially 30 million more insured people, some of whom today don't pay their bills because they're uninsured and have no wherewithal to pay them. So if we receive funds there to offset the cuts in Medicare, hospitals will remain whole. Same thing is true for insurance companies and pharmaceutical companies and so on and so on and so forth. So I think it's a good bill from that standpoint, and I frankly hope it passes.
Let's talk a little bit about budget gaps, in terms of the legislature's look at taxing on hospitals that's being proposed. Can you go into a little bit of detail about that?
Right. As we know, every single state is suffering, and frankly, under the healthcare reform, will probably suffer a little bit more because they're going to be required to, as a mandate, to fund Medicaid at a much higher level than they do today. I believe it's 150% of poverty versus 100% of poverty for Medicaid recipients, and states have to match 25% of that. I believe 6 states were given an exemption from that as a way of purchasing their votes by the Senate Majority Leader.
Mm-hmm.
Unfortunately, Georgia was not one of those since we don't have any Democratic senators. So the state coffers will even get worse, but that won't happen until 2014. But because our state is suffering through the same economic distress as every other state, we have to balance the budget, and the legislators are looking at various ways, one of which is to potentially tax hospital revenues. Most all hospitals, not all of them, but most all are nonprofit and get by on very slim margins. This one not accepted. And what they want to do is just absolutely tax those as if we were income tax paying. And just put that right in the general coffers and hopefully draw down some additional federal funds with that. But there is no promise of any additional reimbursement to the hospitals, so it's an absolute tax. For a hospital the size of St. Joseph's, it's about $6 million a year, which basically is our entire profit for the year will be just totally wiped out by the tax, plus a little bit. So it's really, in many ways, an additional taxation by a legislature that's suggested that they won't add taxes.
Mm-hmm.
So it's not one that we favor, obviously, and while we think we've got to have a balanced budget, that one is probably going to kill off several hospitals in this state if they do, in fact, enact that.
Let's talk about survival as it relates to, the evolution of technology, the impact. I mean, when you're talking about the budget situation creating these gaps and you having to be pressured to pay additional taxes, and I'm guessing as far as investment in new technologies, it's got to be a tough choice, like a lot of even private sector companies do. But
the technology it's a two-edged sword. It drives up our cost in that it provides opportunities for care to be provided better as a result of new technological advances, whether they be genetics, equipment, imaging equipment, IT, the gamut of things that are technology-based. At the same time as they provide better care to our patients, which is why we're in business, but as a component of the spiraling costs in healthcare, they're not an insignificant piece, and one which typically the payment mechanisms don't keep up with. But there are a few patients that don't expect the technology to be there for them when they need it, and it's a significant component. Probably the other biggest component is pharmaceutical increases, not just the cost, but the numbers of medications available to be able to be used to cure people. Example is antibiotics. Now that more and more people get antibiotics, the body gets used to the ones they've gotten in the past, and now you have to have a stronger antibiotic the next time they get used to that, and now you have to have a stronger one the next time, and every time they get a little bit more expensive. But technology generally is one of the drivers of healthcare costs, but it also saves money down the road. So robotics is a good example. We're one of the leading robotics hospitals at St. Joseph's, and those patients that have heart surgery here are out of the hospital in 2 days versus 5 to 6 days anywhere else. And so we save in the stay, but the cost of the robot's $1.5 million, and the disposables are $400 or $500 a case. So the money you save on the stay, you eat up in the first day, paying for the robot and paying for the disposables for the robot. So it tends to even itself out.
Well, obviously, our listening audience is made up primarily of technology professionals and people that are involved in the industry of one kind or another, but also I'm sure it's made up of either potential patients or patients for health care. Maybe give us a little insight in terms of, from a senior management role at a hospital, how do you make technology decisions? You mentioned before about obviously wanting to provide cutting-edge quality, yet the balance of being realistic in terms of the bottom line. How do you make those kind of judgments?
Well, first of all, my acid test for any judgment is what's best for the patient. You look at all the return on investment analysis. You look at whether or not it'll shorten length of stay, it'll get people out and get them back to work faster and all that. And so you look at what's best for the patient. And if you come down on the side of that, you've made the right decision. Sometimes economically for us, it is not the best decision, and you just hope that things catch up with it so that it becomes a revenue neutral or a budget neutral matter. But if there's a new technology, whether it's a pharmaceutical, biotech, or hard technology such as a gadget, you generally will want to invest in it because it's what's best for the patient. The obsolescence is the principal problem. They will typically become technologically obsolete well before they wear out. So you have to amortize it over a short period of time and be prepared to not only replace it with the newer model, but to be prepared for a lot of learning curve for people to adopt it and training and so on.
Well, one of the things that I'd be curious about is that any technology, you mentioned robotics as far as heart care and heart surgery, but in terms of new technological advances that will change healthcare delivery the most. I mean, I guess I'd ask that question, but even beyond that, how do you determine that? I still am curious in terms of, I know our private sector individuals are always baffled by the unbelievable constant evolution of new technologies. You mentioned obsolescence. I mean, it's a wonderment how you keep track of all of the discoveries and evolutions in each one of the disciplines you have to maintain. And then how do you determine something like a technological advance that will change it the most? Is that something you could identify for us?
Well, and yes, let's take robotics, for example. We here have 4 robots right now. They're to assist the surgeon doing surgery, in addition to the medical robot. And each one of them is a different version because they come out a little like Gillette razors. They come out with a new one every 18 months or so. Mm-hmm. So we actually have 4 different kinds, and it's hard. You want to do what's best for the patient again, and each one of them is a little bit better than the previous one, but the base one is still pretty good. But the highest level one is the one that has all the whistles and bells on it, and there's certain patients that might benefit from that. So one of our tribulations all the time is which patient gets the advantage of which technology when the availability of it can't serve all the patients. And you make that on the basis of which patient can benefit the most from that technology versus which one doesn't really need the additional technology. And that's really the surgeon's judgment or the proceduralist's judgment if in that particular case. We have to rely on that when you have a scarce resource to allocate that. But you have that time and time again, whether it's cath labs or surgical suites or robots or what have you. But and surgeons usually make pretty good judgments for that. Same is true with the new orthopedic implants. Some are really not necessary for inactive individuals who are in their later stages of life. Do they really need the Cadillac ceramic implant, or is there a better demand match for somebody who's 55 and has got 50 good years ahead of them at a very active lifestyle? And those are generally, we leave those judgments up to the surgeon working together with the patient, but one is 3 or 4 times the cost of the next one. And of course the reimbursement of the hospital is the same. It doesn't matter. So that's an example of an implant kind of technology. Same is true of stents, of cardiac stents. If you think about what one technology is going to change medicine the most over the next 20 years, I believe it's genetics and genetic testing. I think in terms of the one thing that has the greatest potential to impact cost, impact decision making, and impact proper utilization of healthcare, it's that. And as it gets more into the mainstream of medicine, as opposed to kind of a sideline, kind of a gadgetry kind of thing, which I think it is kind of today. It's been in the mainstream for obstetrical work for a long, long time to help guide people about the right kind of decisions to make in looking towards pregnancy. But it hasn't been in the mainstream of cardiac care and orthopedic care and so on for a long time. But now, today, you can go get a KIF6 and know for certain whether any statin is going to help you or not, or whether you really need to worry about your cholesterol or not. I had one. I don't have to worry about it. I'm going to die of something else, but I'm not going to die of that. I don't have the gene.
When you think about it, again, leaning over to a private sector discussion, and you're talking about a CTO or CIO and the decisions that have to be made in just terms of operational technologies, not operations meaning the surgery, but operations in terms of how the facility gets run on a day-to-day basis.
Right.
And I would think our audience would be absolutely amazed about the process that must be used internally for you to evolve, educate, review, analyze. I mean, is there committees or?
Well, we do. We do have some process committees, and you have to involve all the right people.
That's got to be mind-boggling.
To help make
and then setting up budgets to marry those,
well, and they're obsolete the day you set them up, because a new technology comes along the line just as soon as you make any decision based on it. And, of course, a lot of people make their living selling that technology, and a lot of those are highly incentivized individuals, so you have to be a little bit circumspect about the latest thing that comes out. Some of it is worthwhile, some of it doesn't add much value. And so we have a value analysis committee that helps us determine, is this the right thing to bring in? You read in the paper there's a new kind of surgical glove that's being developed.
Yeah, I did.
That's latex-free,
or
at least the rubber's latex-free. Right now a latex-free glove is 3 or 4 times the cost of one that isn't. And if they can bring those out at half that price, then, we're all over that. That's pretty low tech, but we go through millions of gloves a year. Almost every exam is a new pair of gloves, if you might imagine. So,
well, and then you've got something as incremental and as seemingly incidental. I was watching a program the other day on cell regeneration and the actual evolution of being able to,
we do that. Body parts. We do that here today. The liver regenerates itself all the time. If you remember your mythology, it's not mythology; it's real. It's about the only human body part that regenerates itself. But if you inject stem cells, these are adult stem cells, not fetal stem cells, into a person's leg, for instance, where the veins have started to and arteries have started to collapse, you can save a leg that would otherwise be gangrene. You inject those into the lower leg, and you will turn the leg into you will have new vasculature that will regenerate. We do that today here at the hospital. We also regenerate heart muscle by taking your own stem cells, reconstituting them, injecting them into the heart muscle, and growing new heart muscle, whereas previously it had been dead. And as long as you can vascularize it with new arteries, with a bypass, then you have new heart muscle and new blood supply, and you have a heart that's going to last years and years and years longer.
Well, again,
stave off transplant for another 10, 15 years probably.
Our listeners can't watch my head rattling back and forth in terms of just overwhelmed in terms of, I can't even begin to think. Is this, and I've just...
Well, there's some low-tech stuff, too. We're looking for, the chips that can help track things. We want to put those in a lot of our technology here to help track patients and track supplies so that we know where they are in the hospital. And so there's a lot of it can be used in industrial engineering process. Hospitals are gold mines for industrial engineering improvement. So technology is a big application there.
Well, you were covering that subject. Talk about in terms of labor and how does technology affect the health.
Well, that's one. The most prized commodity we have here in any hospital is the nurse. It's about a third of any hospital's employee base, and it is what a hospital is nursing. Everything else can be provided in an outpatient center, but overnight care is provided by nurses. So anything you can do to save labor for a nurse is money in the bank, both for the patient and the hospital. So if there's ways to save steps for nurses, to save whether it's about 30% of the times in documentation. So IT systems are key. If they're intuitive and they can document things that the nurse would otherwise have to do manually, tremendous labor savings. So we're looking all the time for things that can improve the efficiency of nursing.
Well, once again, I think the subject is extraordinary. I would invite any of our listeners, if they wanted to take a moment, they can go to TAG TV. It happens that we've just recently had a conference called Vision 2020 that got into some pretty unique details and discussions as it relates to the stimulus package and some of the things that are happening in the healthcare industry. But as we were talking, Kirk, I was thinking of James T. Kirk, in Star Trek, because I would imagine you've got to be. It's not science fiction, but it's awful close to it when you think about where you are now and where you're going to be headed over the next decade or so. And kudos to you guys for keeping track of it all and managing it so well and doing such a great job at your hospital.
Well, beam me up, Scotty. We're
really
we're all very excited about the work that TAG does, and happy to be a part of the Atlanta community.
Well, Kirk, thank you for joining us today on Tech Talk.
You bet. Have a great day.